Thanks for joining us on the news tonight. Let's tell you that the following report contains disturbing images and viewers' discretion is advised. We're staying with the developments in Jigawa State, where the death toll from the devastating tanker explosion on Tuesday has now risen to 166 and 104 hospitalized with severe burns among the survivors. The explosion occurred in Majia town of Taura local government area. About 50 victims with severe burns are receiving treatment in hospitals in Jigawa and Yobe states. In a visit to the affected area, Secretary to the Government of the Federation, George Akume, conveyed President Tinubu's condolences to the government and families of the victims. He said the president has directed the National Emergency Management Agency to take swift action in providing aid to the affected families. Chairman of the Nigeria Governors Forum, Abdurrahman Abdurrazak, has also sympathized with the victims, pledging support.
As I have already said, the president decided to assemble this delegation to condole the good people and government of Jigawa State over this very, very unfortunate incident. So many lives have been lost. We have visited some of the survivors in the hospital. President himself has directed immediate investigation of what has happened by the Federal Road Safety Commission, not just incident, but other similar ones in the country. The whole purpose is to reduce, as it were.
Immediately it happened, all the governors called in to the governor of Jigawa State, and you can see I'm here. Some other governors are on their way to Jigawa State. It's about more information dissemination in our communities about the danger of tanker explosion, oil spillage, containment. So it's about passing more information about the dangers and hazards of this thing.
Mr. President has asked his aide to call me immediately this thing happened, and he sympathized with us and he condoled us. And again, today he has sent a high-powered delegation under the leadership of the Secretary to the Federal Government.
In a related development, 32 victims of the recent Jigawa tanker explosion recently receiving treatment at Aminu Kano Teaching Hospital are responding well to medical care. Also, health authorities at the Federal Medical Center Nguru in Yobe State are working around the clock to provide care for victims of the tanker explosion that killed more than 150 people. TVC News' Michael Oshoma and senior reporter Ibrahim Issa reports.
It's been 48 hours since a tanker carrying premium motor spirits exploded in Majia, Taura local government area, claiming over 150 lives, injuring many others. The injured were rushed to various hospitals, including facilities in Nguru, Yobe State, Duse in Jigawa, and Aminu Kano Teaching Hospital, AKTH, in Kano State. 32 of the injured are now receiving care at AKTH, with many housed in the Magaj Nambata Bonds ward.
So presently we have bed capacity of 18 and same occupied by Bonds patients.
Victims speaking to TVC News recount the harrowing experience, sharing their grief over the loss of loved ones and the explosion.
We had people asking for help in town, that a tanker has fallen. At first, we thought it was a thief, and I later learned that my son was out there, so I rushed to get him, then I got caught. Around 11 p.m., we were about to lie down. We heard the tanker fell. Then we heard that our young ones are out. We were caught up while trying to save them.
The management of Aminu Kano Teaching Hospital says they have been providing continuous care for the victims since their arrival.
At present, we are wishing we had 32 patients that are admitted in various wards with burns injury. The burns ward is already filled up, so we have to move on patient to that.
Treating burns is undoubtedly expensive, but the Amiri Kano Teaching Hospital is providing 48 hours of free medical care to the victims. But as that window closes, they call on the government and philanthropists to wade in and provide support for their full recovery. Typically, burn patients can expect to recover fully within 3 to 6 months, though in some cases it may take up to a year. Among those affected is Muhammad Shuaibu, a former member of the Jigawa State House of Assembly. He tragically lost a son in the explosion, and another child is currently undergoing treatment. Shuaibu has called on the government and security forces to secure areas prone to such accidents to prevent future tragedies.
Wherever such accidents happen, the government should take a major action.
As time passes, the victims remain hopeful that, with the necessary support, they will recover and return to their lives. Ibrahim Isa, TVC News, Kano.
This is Federal Medical Center in Unguru local government area of Yobe State, where some of the injured victims of the Jigawa tanker explosion are currently receiving medical treatment. This is the emergency unit where the lives of some victims of fuel tanker explosions hangs on a thin thread. The burns on the survivors' bodies serve as a haunting reminder of the unimaginable horror and agony they endured. Yet, despite their traumatic experience, they consider themselves fortunate to be alive. Now, they pin their hope on the medical treatment they receive here, which promises a second chance at life. Fatima Musa, the mother of one of the survivors, was overcome with emotion as tears streamed down her face. Among the 35 survivors brought to this healthcare facility, 4 are children between the ages of 10 to 13 years. Sadly, 2 children in the same age group were among 6 confirmed dead by FMC medical officials. The healthcare workers spoke with TVC News. They are devastated by the loss of lives, but working hard to save more lives.
So we were informed that there are many on their way. So we understand that seeing the gravity of the burns, we have to devise a strategies, mobilize doctors as well as the nurses and the attendants and volunteers. So we evacuated the normal accident emergency patients to other wards, preparing a venue and place to receive those explosion victims.
We have overstressed our resources. We have to call for external help, and even we are still on it. Like, since they have brought all the patients since yesterday, we have to find a way of create space out of inavailability of space. We've all been on our tools since yesterday, and even to get time to rest has been very difficult.
We were told that many of them were unable to open their eyes when they were rushed into the facility last night, but now they are responding to treatment. As the survivors continue their gradual recovery, medical staff remain optimistic for a successful rehabilitation and discharge. Michael Oshoma, TVC News, Unguru, Yobe State.
Earlier, the medical director, Federal Medical Center, Unguru in Yobe State, Professor Hadisa Usman, was on TVC News to give an update on the victims of the tank explosion receiving treatment at the hospital.
We received 34 of these victims in our center. As of the time, in the last 1 hour, we've lost 6 of them. Currently, we are left with 38 of them. Most of the cases, unfortunately, are to some extent a bit not too good, with almost 75% born, and some of these born are second-degree burns. Some of them are male in the age range of 20 to 50, And unfortunately, we have 3 children. We just lost a child out of these victims. And we've been trying to make things easy for them since their arrival yesterday.
Away from Jigawa State, let's turn to Abuja, where the federal government has received more than 800,000 doses of the R21 Malaria Vaccine out of 1 million expected doses, making up the first batch of the vaccine. Health authorities revealed that Kebbi and Bayelsa states will be the first to receive the first phase of the rollout campaign. TVC News' Kemi Balogun has details.
Nigeria is the second after the Central African Republic this year to receive doses of the R21 malaria vaccine developed by the University of Oxford and the Serum Institute of India. The strategic cold store now has a stockpile of the first batch of 824,000 doses to kickstart the nation's malaria vaccine rollout campaign.
The vaccines are only one tool, additional tool that we layer on top of these other interventions. And the R21 vaccine is the one that has shown the most efficacy. And we believe that what we will learn from Kebbi and Bayelsa will tell us a lot as to how best to scale up this effort, because these are expensive vaccines as well.
We have 826,000 doses. We expect another 140,000 or so to make 1 million doses in this first batch. Every child, every person that is vaccinated needs to get 2 doses. So we know that that's a limited number of people.
We need to protect children. We need to protect the youth. We just concluded the Summit of the Future in New York. We all agreed on the roadmap. And the part of those efforts is to ensure universal access to vaccine for all those who want it.
Transportation and storage is a key issue. How you can ensure that the cold chain has the integrity needed to keep safe the vaccines and to keep them effective. But we are confident and we know that we have the capacities, the Federal Ministry of Health and NPHCDA, they have the capacities to store them and to transport them.
A national malaria elimination task force has also been activated as part of efforts for malaria control in the country. Kemi Balogun, TVC News.